First, we will start by showing you the muscles, tendons, bones, and ligaments in the lower leg. Right here, you can see the tibia, and over here is the fibula, and here is the tibial tuberosity. And down here, which you cannot see from the outside, is the fibular notch between the distal fibula and tibia. The muscles of the lower leg consist of the gastrocnemius, which is the calf muscle, the bigger one, and below and underneath is the soleus, and they both plantar flex the ankle. The anterior tibialis dorsiflexes the ankle, while the posterior tibialis, in between the bones, inverts the ankle. The peroneus longus, peroneus brevis, and peroneus tertius all evert the ankle.
These are the different movements of the ankle joint. Dorsiflexion, plantar flexion, inversion, eversion, external rotation, internal rotation.
Now we are going to walk you through some special tests that we would use on the lower leg to see if an athlete has a stress fracture. The first is the bump test, in which the patient sits with their leg off of the end of the table and a straight knee, and the examiner should be in front of the heel of the injured leg while stabilizing the leg with his or her non-dominant hand, like so. The examiner will bump the calcaneus using the palm of their dominant hand, progressively increasing their force. If the athlete presents pain, there is a possibility of a fracture of the calcaneus, talus, fibula, or tibia.
Next, we will demonstrate the squeeze test. The athlete will lie down with their knee extended, and the examiner will stand next to or in front of the injured leg while cupping their hands behind the tibia and fibula away from the site of pain. The examiner will gently compress the fibula and tibia, gradually adding more pressure if no pain is shown. A positive squeeze test will present with pain, especially if away from the compressed area.
There are many special tests to test for an ankle injury. The first is the anterior drawer test. The patient will sit over the edge of the table with the knee
Extended.
and the examiner will sit in front of the athlete while stabilizing the lower leg and cupping the calcaneus while the forearm supports the foot in slight plantar flexion. The calcaneus and talus are then drawn forward while stabilizing the tibia. Am I doing good? If the talus slides anteriorly under the ankle mortise compared to the other side, or there is a clunk as the talus subluxates and relocates, an ankle injury is present.
I am going to demonstrate the inversion stress test, or Taylor tilt. The patient will sit with their legs over the edge of the table, and the examiner will stand in front of the athlete with one hand grasping the calcaneus and maintaining the foot and ankle in a neutral position, while the other hand stabilizes the lower leg with their thumb placed along the calcaneal fibular ligament so that the gaping of the talus can be felt. The examiner will then roll the calcaneus medially, causing the talus to tilt. If the test is positive, the talus tilt excessively compared to the opposite side, or if pain is felt.
Next, we will demonstrate the eversion stress test. The positions of the patient and the examiner are the same as the inversion stress test, only the examiner places their thumb on the deltoid ligament to feel the gaping of the talus. The examiner will roll the calcaneus laterally, tilting the talus and producing a gap on the medial side. Again, if the talus tilts excessively or pain is felt, the test is positive.
Lastly is the external rotation test, or Kliger's test. The patient will sit with their legs over the edge of the table, and the examiner will stand in front of the patient with one hand stabilizing the lower leg, being careful not to compress the distal tibiofibular syndesmosis, and the other hand grasping the medial aspect of the foot while supporting the ankle in a neutral position. The examiner will externally rotate the foot and, depending on what he or she is looking for, can either place the ankle in dorsiflexion or place the ankle in slight plantar flex position. If the deltoid ligament is injured, there will be medial joint pain, and if the syndesmosis is injured, pain will present in the anterolateral ankle near the distal tibiofibular syndesmosis.